Hey y'all, Justin here, back at it. Sunday, April 5th, 2020. I've been thinking a lot lately about just how dangerous of a position that grocery store workers are in, and service workers in general. We really ought to be doing all we can to support them, because without them, we'd be so screwed. The restaurants, the stores. I saw an article today that hit right on that subject and hit close to home here in Chicago. The Evergreen Park Wal-Mart had two employees die from coronavirus. And so I'm going to read a bit of this article, and I will link the article in the description. And I'm going to talk about a really cool tool that we have to help organize our workplaces. So, as for the article on the Walmart deaths, we find out that Walmart did not provide the workers' names, ages, how long they had been with the company, or even exactly when the workers passed away. They just said that the two associates had not been in the store for more than a week at the time of their death. Walmart said it has implemented various cleaning, sanitizing, and health measures in the store, including bringing in an outside company to clean high-touch areas of the store, such as front entrances, carts, registers, bathrooms, and food areas, including produce and meat. The company said that within the past week, it passed a third-party safety and environmental compliance assessment, as well as a health department inspection. Now, I have quite a few questions about this. Who was the third party that did the assessment? What were they assessed on? The health department, how have they altered their code or inspection specs to deal with the coronavirus? We don't know yet. Workers at grocery stores and warehouses deemed essential businesses amid the COVID-19 outbreak have expressed concern that showing up to work puts them at risk of contracting the disease. Yeah. You could say that again. In recent days, a number of retailers have said they will provide workers with masks. But sourcing such protective equipment has proved difficult as hospitals and health workers also struggle to get their hands on such gear. Walmart, the largest private employer in the United States, has waited to secure protective gear to avoid limiting equipment that could go to strained health workers, Dan Bartlett, the company's vice president of corporate affairs, told reporters. So, I do approve of that, making sure that healthcare workers get theirs first. That is the front line. But these retail workers and grocery workers are right there in the thick of it with all sorts of air being breathed around them by, everyone. The company will need more than 7 million masks each week for its employees. The first shipment will arrive in 1 to 2 weeks. So these workers are in dire straits right now. And man, they need help. They need help. Help themselves, help from the outside, help from below, help from above. And help is available. The United Electrical Workers Union, UE, along with DSA, the Democratic Socialists of America, have started a program where they're offering the experience, the knowledge, and the wisdom of labor organizers and workers who have been through battles fighting for working rights. And anybody can fill out a Google form and be put in touch with somebody who can offer assistance, ranging from just a little bitty help with a question to potentially helping to organize your entire workplace to take action and make some demands. So I have also put a link to that Google form in the description, and I think I will try to put it in one of those little annotation things too. I'm still a novice on YouTube. I've been wanting to make a lot of videos, and I have hardly made any videos, so bear with me. Now, to get to my main point, I think that grocery store workers are possibly at higher risk than nurses and doctors in some cases. Think about it. Hospitals have complex sanitation procedures in place already, and health experts throughout the building. Hospitals also have information about the patients, most of the people who are inside the building. They know the status of their health. Hospital workers have more access to protective equipment. Not all the access they need right now. There's still a big strain on that, but more protective equipment is, of course, available to hospital workers. These grocery workers, as that VP said, are sort of left waiting in the wings for these masks. And gee, you think they'll be able to get the $7 million per week that they're needing once it starts? That seems tough. And that's just Walmart, who has unlimited piles of money and resources to get that equipment if they so choose. So grocery store workers have none of the protections of hospital workers, really. They're up against whoever chooses to walk into the store in whatever condition. Being a cashier has gone from being a very safe job to one of the most dangerous jobs there is in no time at all. Now, I don't mean to suggest that hospital workers, be they doctors, nurses, service workers, administrative workers, I don't mean to say that they're not at high risk or making huge sacrifices. They are, and thank you, everyone in healthcare working your butts off to keep us healthy as we can be. Thank you. But I want to make the point that people working in grocery stores or restaurants or elsewhere in the service industry are not only keeping our society from screeching to a halt, but they're putting themselves in grave danger every day. Many do not have a choice. They need the paychecks. Anyone working in these conditions should be getting hazard pay. They should be getting double their pay. And that's the key, is getting workers to recognize their value and their worth. Right now is the time to point out to the owners of these businesses that nothing goes without us. Without us keeping the wheels moving on the ground, those frontline workers, everything falls down. And so now is the time to organize, to band together, and demand pay increases and health benefits that we should have had in place a long time ago. They are more than necessary right now, and now is the time to fight for those rights. So if you or anyone you know is in a position to organize your workplace, fill out that form, again, down below in the notes, and let's get these wheels turning so that when this pandemic is over, we have lifted the standard, the baseline of workers' rights and protections and benefits and pay, which has been so sorely needed for such a long time. And here we are in a time of crisis, a time when people are scrambling, and a time when routines have been busted. Let's break the routine of minimum wage jobs being less than livable wages. Now is the time for action. And we can't be marching together in the streets, but we can sure as heck be banding together digitally. Yeah, digitally, because please don't have any more physical contact or share spaces with people any more than you need to. We can't afford that. Well, I've said my piece. If you have any thoughts on this, please comment below. Please like the video if you like the video. Please dislike the video. Thumbs down if you didn't like it. If you're still here and you're gonna thumbs down me, I respect you for sticking with it. Leave me a comment. Let me know what wasn't so good about this. I'm trying to improve myself making these videos. If you think I'm just totally, you know, saying meaningless garbage, let me know. If you think that I'm a genius, also let me know, because who wouldn't want to be told that? Okay, this is getting silly. I'm Justin. I'm just in it for the justice.